So we've been taking a look over the last few days at how the spending review is impacting on people in different sections of society around West Yorkshire. The Chancellor announcing details of the spending review last week. This morning we're taking a look at how it could affect people with disabilities. We heard earlier from Kalaya Franklin. She's got hypermobility syndrome and Ehlers-Danlos syndrome, a condition which leaves many sufferers facing crippling pain as a result of limbs that easily dislocate because of joints that bend in different directions.
She recently campaigned to try and save the specialist service that treats people with this condition at Chapel Allerton Hospital in Leeds. But now in her blog, she's turned her attention to the Prime Minister and how the government spending review could affect people with such disabilities.
We can speak to Kalaya this morning. Apologies, is that how you pronounce your name? Is it Kalaya?
No, it's Kalaya.
Kalaya, thank you. Apologies, I
Morning.
must get that right. Thank you for joining us this morning. So we're taking a look at how the spending review is affecting different people, different groups within society. Your initial reaction to George Osborne's announcements last week?
Shock and horror, basically. Having made a lot of noise about how they were going to protect the most vulnerable in society, particularly disabled people, the coalition government have disproportionately targeted disabled people with the spending cuts that they're making.
So give us a few examples. What issues in particular worry you about this?
I'm particularly concerned about the removal of the mobility component of disability living allowance from people resident in care homes. Yesterday the news was full of the tragic neglect that happened to a man called Jamie Merritt, who was dependent on a ventilator, and his nurse turned it off because she wasn't sufficiently trained to know how to operate it. It was approximately 40 minutes before the paramedics were able to connect it, and Jamie was brain damaged by that time.
We saw the footage on the news last night, and it was, as you say, truly shocking. But that wasn't necessarily as a result of the cuts in mobility allowance that you were suggesting, was it?
No, it wasn't.
That was a poorly trained nurse, wasn't it?
It was, supposedly, but she didn't have the specialist training that she needed to use the ventilator. Jamie's just an example of one of the many people who have disabilities of that kind of level and the vulnerability that it means that they live with. People living in care homes, if the removal of the mobility allowance goes ahead, they will be facing not just that kind of vulnerability, but looking at their four walls and nothing else all day, every day.
And what does this mobility allowance? What did it offer? Is it access to a cheaper car or to transport?
It's access either to a vehicle, perhaps a wheelchair-adapted vehicle, but many disabled people use it to purchase power wheelchairs. As they're so expensive, the NHS is not able to cover the cost of such specialist wheelchairs. So it may be confining people not just to their rooms, but to their beds.
I mean, what the coalition government are arguing is that if you are in that situation where you're being cared for in a home that has that specialist background, that they will often have their own transport facilities to be able to keep your mobility and to go out of your four walls and to visit places, family, shops, museums and the like.
In some cases that's true, but in some homes they actually supply that service by pooling the residents' high rate mobility allowance because they don't have separate funding to do it. But also, just because people have physical needs that mean that they need to live in residential care, it doesn't mean that they're not capable of participating in social or work environments independently. And taking away their ability to purchase powered wheelchairs or wheelchair-accessible vehicles is going to prevent those who can go to work from doing so, which seems contrary to all the other changes that the government are trying to make.
It's a sad fact, though, Kalaya, that people do abuse the system, and that the government will argue, well, we also need to change things to stop people abusing it. So, would you agree with that to a degree?
That's very true, but I think if we set out to create a system that's based on stopping people defrauding it, all we will ever achieve is damaging those who really need it. Disability living allowance, this fraud rate is actually only 0.5%. These are the DWP's official statistics. So less than 15,000 claimants, according to them, are fraudulent. Even if they were out by a factor of 10, that would leave over 350,000 genuine claimants who will no longer be entitled to disability living allowance because the government have made it very clear that they intend to change the eligibility criteria.
And you've set up a new online campaign to try and draw attention to some of these issues. What are you hoping to achieve through that?
We have. Disabled people don't have a very clear voice in media or in politics. So we're hoping to unite the broken of Britain, which is a play on David Cameron's Broken Britain Society, to give people a voice to explain that most people claiming benefits have worked all their lives, have paid national insurance and tax, and that they would love to work, but through no fault of their own are no longer able to do so.
A huge amount of issues there to discuss. Thanks for joining us this morning. That's Kalia Franklin, disability campaigner, on the show with us today. And a bit later on, we'll be speaking to a counsellor who oversees adult health and social care for one of our local councils and ask what she thinks the government's cuts what difference those will make to services.